Hey guys, today's day 4 of my stimulation. So to give you a recap, my dosage is 187.5 IUs of Gonal in the morning and 150 of Menopur at night. So day 2 and 3 has pretty much been the same, just less nervous with the shots, feeling a bit like a pro at it now, mixing especially the Menopur. So the only difference is that I feel a little bit bloated lately, but that's it. The doctors told me just to keep with my dosage, so that's what I'm going to be doing for the next couple days until my next visit in 2 days. Hey guys, today's day 6 of my stimulation. Lately I'm just feeling the same, except that in addition to the bloating, I'm also feeling a bit sensitive in the stomach. Like when I put my seatbelt on, you can feel it in a different way, but it's nothing I can't deal with. And then I had my second monitoring appointment where I went in for both a blood test and an ultrasound this time. The blood test, we measured the estrogen, the LH, and the progesterone, and I just got my results back. The estrogen went from 263 a couple days ago to over 900. We weren't expecting my estrogen to shoot up that fast, so we lowered my gonal dosage to 150. It was previously 187.5. And we also are adding ganirelix to my schedule tonight. And I wasn't expecting to start ganirelix so early, so now I've got to order a couple more of them just to make sure I have enough for the whole stimulation process. And then the ultrasound, we measured the size of the follicles, and they range from 8 to 16. So ideally, we hope to have the follicles grow at the same rate. So I'm going to come back in on Friday, and we'll see how they're doing with the changes of my dosage and the new medication. So I'll keep you guys updated. Hey guys, so today's day 8 of injections. I'm not allowed to be exercising, but I am allowed to walk, so I'm taking a little stroll. I went in for my third monitoring visit today at the Center of Reproductive Medicine, and all is well. My estrogen levels are going up as they should be. My follicles are getting bigger as they should be. So we're keeping my dosage the same, and I'm coming back in 2 days. My discomfort has remained the same, just like bloating and the sensitive stomach. So I'll keep you updated and let you know what happens in a couple days. Hey guys, so today's day 10 of injections. I was expecting today to be my last monitoring visit and also my last day of injections. I went into the quorum offices to do my blood work and my ultrasound. And when the ultrasound probe went in, I was cramping. It was the first time I had started cramping, so my ovaries are definitely getting bigger and more sensitive. So when you go in for the ultrasound, you're essentially measuring the size of your follicles. And if your follicles are over 14, then you have a better chance of holding a mature egg. And I had a bunch of follicles that were borderline 14. So we decided to do one more day of injections just to try and see if those borderline ones can have mature eggs when I go in for the retrieval. So I've got to get one more day's worth of medication, and then I've got to come back to the quorum offices tomorrow just to confirm that I'm ready for my trigger shot tomorrow. Hey guys, so today's day 11, and I went to the quorum offices today and I got the okay to take my trigger shot tonight. When you do your trigger shot, you schedule your egg retrieval for 35 to 36 hours later. So that means that tomorrow I get a free day of no injections. I will have to go into the quorum offices one last time to do blood work just to make sure the trigger shot worked, but I'm almost there, and I'll of course keep you updated and watch my videos and pictures as I get to the end and hopefully find out soon how many eggs I get. So the morning of my egg retrieval, the doctor retrieved 24 eggs, but only 15 of those eggs were mature and 2 were immature. So what does that mean? Well, it doesn't mean I get 15 babies. What it means is if I decide to use these eggs and want to continue through the IVF process, then I have to thaw the eggs, fertilize them, get them to day 5 blastocysts, check to see if they're genetically normal, and then transfer them into my body. So at each of these stages, you lose eggs in the process. So me as a 34-year-old with 15 mature eggs, I have a 70 to 80% chance of having one live birth and a 30 to 40% chance of having 2 live births. So in the end, this took 2 months of my life, 6 weeks of just prepping and waiting, getting my body prepared for this, and 2 weeks of actual injections leading up to the egg retrieval. And a lot of women who struggle with fertility, they struggle for years, if not decades. So these 2 months, really 2 weeks of my life, could possibly have saved me years to come. Because in my reality, I feel like I'll be ready to have kids maybe in my late 30s, early 40s. So if I struggle, then I know I have these younger, better quality eggs waiting for me. So I'm really happy I did this, and I hope that this is helpful to anyone who's considering freezing their eggs or just on the fence about freezing their eggs. I think it's something that's really important and something we should really consider, especially if you're in your mid-30s. So thanks for following me, and if you have any questions, you're always free to reach out to me.